Everyone, and we're ready. We're back for the Thursday edition of the workshops for the Winter Wonderland Wonder Wellness Week, December version. And today at 9 o'clock, of course, we have the one we've been talking about, the new guy, the new kid on the block, but with a world of knowledge, world of experience to back him up. And we're going to just talk about some of the most common things he sees, and maybe we'll throw in some of the uncommon things you see. Dr. Phil Ross.
How's it going, guys? Good morning. And yeah, just to start it off, one of the main things we see coming in all the time is you hear the dreaded disc bulge or disc herniation. Oh, I got to go in for surgery or else my back's going to hurt.
Surgery.
Yeah, so there's a couple different.
And why is it, do you think, that they have to go into surgery? Because who have they seen up till that point?
So yeah, usually you go to your PCP, get an
Yes,
MRI,
right.
and when you go to a surgeon, surgeons get paid by cutting.
By cutting, that's right.
So-
Surgeons cut. They cut. This is what they do. They don't know anything else,
Absolutely.
right? It really pays to get another opinion.
Yeah, absolutely. So
How do you help them?
There was an article that came out in the NJAM, New England Journal of Medicine, very, very good journal. It was about 3 years ago that said they studied 100 people with disc bulge and disc herniations, and what they saw was after 2 years without any treatment, they actually kind of reabsorbed themselves. So that's why when I ever have a patient and they come in and they say, "Doc, I gotta go get surgery." Wait, let's pump the brakes here. Let's try conservative treatment.
So even without doing anything, after 2 years, they kind of regenerated.
Yeah.
So you can speed that process up.
100%.
All
So,
right.
and that's what where a couple of the tools we got in the room come to play. So, long story short, this is just a quick model of a disc herniation or a disc bulge. So, you have 22 to 24. They're called lamellar rings. So that's kind of the cage. And inside is your nucleus pulposus. That's the property of the disc. It's kind of like a toothpaste consistency.
Okay.
Over time, when you have pressure on your discs, sometimes these layers fail, and then you'll have your disc herniation or disc bulge. And when we'll just call it chemical soup, you have 8 main inflammatory proteins that come out, and they'll actually hit the nerve, and then the nerve grows 3 times its normal size.
Are those the gags? Those are the
yeah,
right?
Yeah, absolutely.
Yeah.
Yep. And interleukin-6 and all those.
Yes.
Yeah. So
Okay.
what happens is when that chemical soup hits the nerve, it grows 3 times its normal size, and that's when people have the "Doc, my leg's on fire," because that nerve keeps depolarizing. So what's actually nice about what we have in the clinic is we have that class 4 laser, which actually decreases the inflammation of the swollen nerve. So usually after 3 or 4 treatments and a couple corrective exercises, these patients are like, "Wait a second, my calf pain's now to the back of my hamstring, now to my glute, and then it's their back." And
so it actually has a progression of relief.
Yeah.
Okay.
So
Interesting.
So the main goal for me is to get their pain it's called decentralize. So leave their peripheral, leave their periphery and the distal symptoms to their back. So how we do that is what me and actually Dr. Orbach both do. It's called McKenzie protocol. So we both took a couple classes in that, and it's basically certain corrective exercises and movements to actually help that pain decentralize to your back, and you feel a ton of relief.
Okay.
So how that works too is we have so I'll just give it like a little demo of an exercise you can do at home. But say you have low back pain and it's running down your left leg. What happens is this nerve's swollen, so it's actually not clearing the hole it comes out of, this foramen. So we actually take you through a couple of different corrective exercises to actually help increase the diameter of that hole so that nerve's not getting pinched.
So this tissue right here is a representation of a nerve?
That is nerve root, yes.
Nerve root.
Yep, and that's what it's supposed to normally look like, nice and small. And when they get inflamed, they go 3 times its regular size. And that's when you hear the old pinched nerve and the radicular symptom running down the leg.
Okay.
So there's certain things you could do, certain exercises to help increase the diameter of that hole so you don't feel that radicular symptom running down your leg. Okay. So that is a very, very common one. Also coupled with an anti-inflammatory diet, CBD is fantastic for it, anti-inflammatory, and the corrective exercises. And then what I like to do is we have a rehab room as well, take people in and show them different core stability exercises to help support the low back, because it's the yin yang. So if you have a strong core, there won't be as much pressure on your back.
Right. Now, are you a fan of the foam rollers for your back?
Yeah, absolutely.
Is that right?
Yep. So, and the other thing that I recommend a lot of people with multi-level disc bulges or disc herniations is what we got back there is an inversion table. So if you think about it, say you sleep 6 hours a night 18 hours a day, you got gravity compressing down on your spine
Mhm.
and just pushing on this disc. And sometimes you get the disc bulge. So with the inversion table, when we take you upside down and flip you over, it actually helps to distract the
Yeah.
space for the disc.
Right.
And there's a lot of times where people only have relief of their radicular symptom down their leg when they're on an inversion table. Very,
Mhm.
very common. And that's not just specific to the low back. That happens in the neck too. A lot of people will have computer jobs where they're working 40, 45 hours a week.
Getting tech neck.
Absolutely, yeah.
Down
The whole
here.
upper cross syndrome.
Yep.
And just like Phil over here.
Phil's got tech neck.
And
Better
so,
get in and see Doc today, Phil.
and so what it does is that pressure will just kind of sit on that
Mhm.
nerve, irritate that nerve. That's when people feel the pain running down their arm. Very, very common.
Interesting.
Yeah. And
now, is it always pain, or could it just be tingling and numbness?
absolutely. So nerves produce different symptoms. It could
Mhm.
be numbness, tingling. Some people say they feel static.
Mhm.
Itching is another common one.
Really?
Yeah, and burning
Ah.
down the arm. Yeah, so that is very common, and that's why just with the laser
Huh.
and just on, if we get them on an X-Flame or an
Mhm.
Inflam,
Yep.
with the CBD and just trying to have a natural, anti-inflammatory diet, that usually decreases all the inflammation.
Let me ask you this now.
Yeah.
Can you, if someone comes in with the symptoms,
Yes.
do you need to see X-rays to diagnose this, or can you do it through your evaluation, your physical evaluation?
Good question. So I have a conservative like a conservative treatment care plan. I usually try 4 to 6 visits without any image because, due to like the orthopedic exams, you could kind of infer without getting the picture.
Okay.
Now, if I have a patient after 4 or 6 visits and they're not really getting any results, then I'll send them for an MRI.
Okay.
So an MRI is going to be the gold standard to see any kind of disc pathology.
Okay.
But
over an X-ray.
yes,
All right.
absolutely.
Good to know.
But to speak to your point, yeah, there's people come in and they have the right symptoms, the right positives on their test. You don't even have to send them for an X-ray and MRI.
Mhm.
Yeah, absolutely. So that is one of the main ones we treat. To also speak to that, so you could actually have peripheral nerve entrapments as well.
Mhm.
So a lot of people coming in, Doc, I think I have carpal tunnel. My hand's numb, tingly,
Mhm.
pain. I don't feel like I have the grip strength in there.
Mhm.
You send them for a nerve conduction study, comes back mild. So it's truly not carpal tunnel. It's actually a peripheral nerve entrapment. So what happens in a peripheral nerve entrapment is you have a tight muscle grabbing on a nerve.
Hmm.
A lot of the times when people have the carpal tunnel symptoms, it's called your pronator teres, this muscle right here. If you're typing on the computer 45 hours a week, this gets tight, grabs on that nerve, and you feel the sensation run down to your hand.
Mhm. Now, how many people have you helped to avoid carpal tunnel surgery?
I would say 98%. There has been 2 patients that came to me where they had severe, and that was the only word, severe carpal tunnel,
Yeah.
and there's not much you could do there.
Okay.
Yeah, but most of the time, if it's mild or moderate carpal tunnel, you could treat that and get outstanding benefits from it.
Good. And I mean, the reason I'm asking these questions, Doc, is because I want people to understand they can come in to see you. You don't have to go get your X-rays. You don't have to get, maybe your PCP has them or somebody has them, and you think, I need to bring my X-rays in for Doc to really give me a good, thorough examination. And you don't.
Yeah.
You need to come in so that you're the X-ray.
Yeah.
Okay.
Yeah,
you're the guy that's going to determine what's going on.
That's why we went through the schooling.
That's
just
right.
with the different testing, orthopedic exams, you can come up with a diagnosis without an image.
Yeah.
Most of the time. There are some times where you need to send for an image, but that's what me and Dr. Orbach do. X-rays, MRIs, ultrasounds, and if need be, why give the patient radiation if they don't need it?
Exactly.
So
Good.
that's
Okay.
one of the main ones. And now when my athletes coming in, treat a lot of tendinopathy and tendonitis. So that could go from anywhere from, it's called lateral epicondyle tendonitis. So your tennis elbow, you have your golfer's elbow, and a lot of people have the quadricep tendonitis, or patellar tendonitis. So
see, now right off the bat, when you're talking tendonitis, most people, I think, out there will think, that's not something I go to a chiropractor for.
100%.
Right?
Absolutely.
But this is absolutely something they should come to see you for, because it's about what's going on around the joint more than the joint itself.
Absolutely.
Right?
And when we hear tendonitis, the suffix itis, inflammation.
Yes.
So what do we do here? We get you on supplements that decrease your inflammation, and we also use laser therapy to decrease the inflammation.
Yes,
so
correct.
I'd say 10 times out of 10, when I have a golfer coming in with that lateral epicondylitis or medial, we use the laser, CBD.
And it doesn't have to be a golfer, right?
It does not. No.
Any athlete.
Yep, I'm
right?
currently working with a patient. She was in yesterday. She's having trouble picking up like a gallon of milk with her hand. You know, she's a
Right.
60-year-old patient, and she's having the pain here. So,
Right.
coupled with the laser therapy, anti-inflammatory diet, some supplements, we could basically decrease the inflammation of that lateral epicondyle. And then what I do is we work on the muscles. So these forearm muscles, if they're tight, they'll pull on that lateral epicondyle. That's where people have the point tenderness pain. So when we do the soft tissue work with the cupping or the grafting and release some of these muscles, it's not pulling on that epicondyle.
Okay, so, and I love what you said just prior to that when you said when we bring them in, we work on them physically, then you couple that with an anti-inflammatory diet and proper supplementation. So, you know, the three-pronged approach, it's not just come in, get adjusted. You know, and I think there's still that stigma out there with chiropractic, but that's changing.
100%.
And you're changing it, and this is going to get that word out to people.
Yeah, absolutely. Good. There's a couple of my buddies when I came back from grad school, I played college soccer with. Why am I going to go see Doc? He's just going to crack my back.
Yeah,
that's not the case. No. There's a specific patient population that I don't even adjust. They just need corrective exercises or soft tissue work. A lot of people. Yeah,
exactly.
So see a lot of tendinitises. And tendinopathy is the advanced version of it. It's been prolonged. Right. Those resolve great, absolutely great, especially with the supplements, just for the inflammation purpose of it.
Absolutely, great, good, love it.
So those are the different kind of tendinitis. Another one that's very common here, that wasn't so prevalent at my other clinic, was the hiatal hernia.
Yes.
And usually that is more structural, if anything. And basically what happens is your stomach goes through a sphincter and actually goes up into your diaphragm. And then people have that chronic GERD, which can lead to Barrett's esophagus, like a precancer.
Right. Yes, absolutely.
And so that's one of my favorite ones to treat, just because that is a legit night and day. Before you walk out of the room, holy mackerel, I feel a lot better.
Exactly. And they're, you know, what they're doing instead is just destroying them when they're on these PPIs and all these over-the-counter you know, antacids and things that they're taking, thinking that's giving them relief when it's really structural. I mean, it's so important to know that. Explain it one more time. The stomach goes up through the sphincter, pushes on the diaphragm.
Pushes through the diaphragm.
And then what? It starts to block the esophagus.
Absolutely. Right. Yeah, and that's when everybody has that. I feel the burning in my chest, the GERD symptom, acid reflux. And you're right. They just go over to the counter and let me take something to try and, you know, ease it. But it's structural, and it usually takes 2 treatments max, and they feel night and day relief. Right.
And this is something that it could happen in so many different ways. What could cause it? I mean, athletes can have it happen. I know it happened to me doing pull-ups.
Really?
Yeah, doing pull-ups, and I just was straining that abdomen, you know, in a way that it just affected it. And Dr. Ope, you know, fixed it for me. You know, so you can do it on any age, right?
Any age,
kids, everybody.
And then when I say you know, drastic relief right at that minute. Me and my girlfriend recently were on vacation, and we did it just once after she had some spicy food down in Mexico, and that was it.
Spicy food, huh?
And that was it.
Sure, that's what did it. Yeah, spicy food.
So that was kind of flaring her up there a little bit. So other things we treat that you would not think you would go to see a chiropractor for, and these are what I kind of like. Post-concussion. So, so we work with a lot of athletes sustaining a concussion, and usually there's a huge neck component to it, for sure. So your vertebral artery is the main blood supply to your brain. So if you have a segmental dysfunction and some of that blood flow is getting shunted, you're going to have symptoms that are long lasting.
When you say the neck plays a big part in it, how much of a connection is there between whiplash and concussion?
Massive. Yeah, massive. Absolutely. And sometimes people are.
So it doesn't have to be a blow to the head.
No, it does not.
See, people need to know that.
Absolutely. Yeah. So most of the time, if you sustain a concussion, it's a whiplash injury, right? So your neck is a major player in that. And so what we do with that is not only you get them on the right supplements, so your magnesium, your omega-3s, CBD for the brain health. We adjust the neck and try to get better blood flow to the brain.
Nice.
And then where I really like getting into it is the neurology aspect of it, and bounce therapy, you know, vestibular therapy. So
wait, what therapy? Bounce?
Vestibular therapy.
Oh, vestibular therapy.
Working on their balance.
Oh, on their balance.
Yeah.
Good. So explain it. How do you do that?
So we back in our rehab room, we have a couple stability discs and a foam pad, and there's different ways. It's actually called the bomb screen. UPMC came out with it, and it's basically trying to sync their brain for the rest of their body so they don't feel uneasy on their feet.
Okay.
So you probably saw me walking with a guy backwards in the hall a couple times on the stability disc, balancing, trying to pick out points on the wall, and just different things to kind of tax your vestibular system to sync your brain with the rest of your body.
Excellent.
And that kind of goes in line with any kind of, balance disorders for people from like, who have chemotherapy, they feel unsteady on their feet. Diabetic neuropathies, unsteady on their feet. So things that you think you would not go see a chiropractor for, you go see your endocrinologist for.
Right.
Come and get worked on. And Joe's going to help me too to speak to the point about neuropathy. So with the laser therapy, you've been doing a ton of diabetic neuropathy. Just because that laser, you have 3 channels on a nerve, the calcium, potassium, sodium ion channel. The laser actually treats the calcium ion channel to kind of help bring back the nerves in your feet.
Okay.
Coupled with the supplements. Yeah.
There's always an issue with a deficiency in that respect. We always see a B vitamin deficiency. We always see a magnesium deficiency, and maybe a combination of those. And maybe it's a circulation issue as well.
Absolutely.
So, once that's determined through your evaluation, and we're going to put the right protocol together, supplement protocol to complement what you're doing with them physically. So it could be, we have a formulation called Relax that's great for the muscles, to help calm the muscles down. We have neuropathies, which really focuses on the B vitamins to help with that tingling sensation far in the limbs. And if we have, we've got other options as well, like SPM.
Yeah.
Now that's one of our newer ones. And I think that, when people have these injuries, maybe they sustain them in a way they didn't really know they got hurt, but then over time, you're starting to see the effects, right?
Yeah.
So we have systemic inflammation there.
Yes. Yeah.
And that's where the SPM really comes in handy. So we got all the options, and then you go on the right diet. You help them with the right diet as well, right?
Absolutely. Yep. And one of my favorites is the Pro Orange. It's just for the antioxidant properties. People respond great to that. The glucolyzed people respond great too. And depending where your A1C is, you have to have a manageable A1C to work with it just to get better. So that's why just very blessed to have the supplement company here as well. It makes my job a lot easier.
Yeah, hemoglobin A1C is the gold standard for blood sugar. People will come in a lot of times, they have done a fasting blood sugar. That only shows you what you did the day before, and you can really work those.
Yes, you can.
Yeah, you can't work an A1C, okay, because it's going to give you a 3-month, movie of your life, not a snapshot of yesterday. So that is the gold standard. We like to see that. Now, do you ever see, do people bring in anything like a C-reactive protein that shows, really hardcore inflammation?
Absolutely.
Yeah.
Yeah, absolutely. So I like looking at blood work because that just, again, makes my job easier, and you could really kind of fine tune your treatment. And that's where the SPMs come into play.
That's where they come into play.
They really do, because you could make dietary changes to, assess the acute inflammation. But everybody has a high inflammatory diet, pretty much. So,
oh my God, yeah. If you're eating the standard American diet, yes, it's inflammatory.
So that I mean, I've been using that the past, Phil. We've been taking SCMs in the Mineral Rich, past 4 weeks now?
Yeah, something like that.
Something like that. Yeah. So I feel great. Yeah, absolutely.
Good.
That's
now let's go topical.
So much stronger.
Philly Phil's flexing his muscles. Okay. Topical. So you mentioned CBD. Now you're talking about the internal, the oil, or are you talking about the transdermal cream?
So it can be both. So people who have more systemic issues, and it's not just like a tendonitis or a spot like that. I like the oral. I like the sublingual. Let it sit on your tongue 1 minute to 2 minutes. Swallow it, just because I feel like it's absorbed a lot better, right?
Yes,
absolutely
absorbed a lot better. When you absorb it in, a lot of it gets absorbed in the mouth, in the mucous membrane of the mouth. So that's getting directly into the bloodstream.
Absolutely.
Yeah, absolutely.
And where the cream comes into play, if you have those tendonitis, so if you have a patellar or a quadricep tendonitis, Achilles tendonitis, I like to use that locally. and it has that transdermal cream, the technology, right? So
Yes.
kind of just if you are a woman who's through menopause, you go get progesterone cream. They usually do it as a cream on your arm, so
Right.
you don't have the first pass effect from the liver.
Right.
So it's more absorbable. So I like to do that, and then use the laser therapy to take the
Mhm.
photon energy to kind of drive it in.
Right.
Yeah.
Yeah, exactly. It's an amazing product. The lipoderm technology is really what gets it in and has an immediate effect. And you can use it on you don't have to have a major injury. I mean, just a soreness.
Yeah.
I can, like, there's been days, even like yesterday. I mean, my knee was a little bit sore from standing all day, and I still had a long night ahead of me.
Yeah.
But entertaining our customers, of course.
Yeah.
But so before I rubbed some on my knee.
Yeah.
And all of a sudden, I mean, I didn't even realize it, but the pain was gone.
Yeah.
When I stopped, you didn't even have to think about it anymore.
And Joe,
But it does work that fast.
Joe, that's a good point. It doesn't have to be a specific Achilles tendonitis or something that's very acute. If you just have chronic, tension, hand pain, you could use that all the time.
Yeah,
Absolutely.
Do we have some questions, Phil?
Would that help with rotator cuff tendonitis?
Yeah, absolutely. So you have 4 rotator cuff muscles: supraspinatus, infraspinatus, teres minor, subscap. Most commonly injured one is your supraspinatus. Actually comes and attaches right here. And a lot of times people with that supraspinatus rotator cuff, they have it's called an impingement syndrome, where they feel pain kind of bleed down the side of their arm, lateral aspect of their arm.
Mm-hmm.
Very, very common. Shoulder, highest range of motion of any joint, so it's the most susceptible to injury. So very common, we treat shoulders here. Yeah.
How often can you? I mean, you can realistically prevent rotator cuff surgery.
Yes, you
right?
can.
I mean, that's a very common surgery right now.
Very, very common. And if you actually look at a ton of people, I think there was another study. I think if you look at 100 people over the age of 65, it was like 87 or 88 of them actually had a slight rotator cuff tear. Very,
Right.
very common.
Yeah.
And you don't even have to be an athlete.
No.
It could be from occupation. It could be from your hobbies, what you like to
Mhm.
do, lifestyle. Very, very common for that. But yeah, for rotator cuff tendonitis,
Picking up your grandchildren.
yeah, absolutely. Yeah. So what we do is, we'll use the CBD in the room,
Uh-huh.
the laser to kind of help heal the rotator cuff muscle
Okay.
as a
Okay.
whole, and then decrease the inflammation through supplements and the laser therapy.
And then, are you also doing muscle resistance work with them on it?
Absolutely.
Okay.
So usually you
Range
have
of motion, right?
absolutely, yeah. So we that's where it kind of gets fun for me, because that's when I get to get hands on, and
Yeah.
we go through different exercises. So there's a ton of different like active release therapies you could do. So if you have
Explain active release.
Active
They don't know
release.
what that means.
Okay, active release. The father term is ART. So basically, it's we could just call it pinning and stretching. So if you have a muscle imbalance, which usually a lot of the times is the case, that puts strain on the rotator cuff.
Okay.
Say your pec gets tight, your shoulder rolls forward, puts more strain on the backside of that rotator cuff.
Mhm.
What we do in the room is we basically shorten the muscle, pin it, and then stretch it back out. So over time, the muscle will actually elongate, so your shoulder will take a natural position.
Mhm.
That's massive in people working at computers all day. Because what do you do at a computer? Shoulders go forward, arms
Right.
go out, and then you get that
Yes.
tech neck, right?
Then you
So
tech neck.
so once we release some of the pec minor tissue, your
Mhm.
shoulder will naturally go back,
Mm.
and then we give you corrective exercises such as like wall angels to kind of cement that.
Okay.
And then we make me and Dr. Orbach both make recommendations. So if you're working at a computer, scoot closer and tuck your elbows back. So you have like I call Mr. Big Chest. So your chest is out and you're not slouched down like this, because
Right.
that will cause a litany of problems.
Oh, that's interesting. Now, I know Dr. O does a lot of work with people on their home workstations to help them out with that.
Yeah.
Are you a fan of standing as opposed to sitting at a workstation?
I like that. Yeah.
Yeah.
Because when going back to the disc property, you have the most pressure on a disc in the seated position, second most laying on your belly, so laying prone, third most standing, and the last laying on your back flat. So a lot of people who are coming in with the neck pain and maybe a little bit of a radicular symptom running down their arm or to their mid back, that's because they're sitting 40, 45 hours for work. And then you're sitting when you're eating.
You're sitting in your
watching
car.
TV.
You go home. You sit out. Yeah.
And-
well, sitting. That we've said this for years. It's the new smoking. It's
Yeah.
what's really destroying health.
And it's
here we are sitting here doing our workshop.
Yeah.
We should be standing.
Right? And then over time, that pressure is just going to crush your disc, and your disc is going to scream at you. And then end result, you might
Yeah.
You know, have a
You
disc
can't get away
pathology.
from it. There's so many things we do for sitting that you can't get away from all of it. You can, you can maybe eliminate some.
Yeah.
But the alternative is get good chiropractic care.
100%. Yeah, absolutely. Standing. And if you're sitting during the workday, every hour, try and get up and move around for 5 minutes. Look, you just can't stay in a seated position for 8 hours.
Yeah.
Stuff's going to go bad.
Oh, yeah.
Absolutely.
Definitely.
Stuff will deteriorate.
What else you got for us?
So a couple other things. Knee pain. Knee pain's a tough one. A lot of people try and go to different specialists for knee pain, don't get too many results. A lot of the time, it's actually a muscle imbalance. So a lot of people have it's called your IT band. It's on the outside of your leg. A lot of times, that's a lot more tight than the inside of your leg. So you develop it's called a patellar femoral tracking disorder, where your kneecap, instead of going linear, actually kind of shifts to the outside because that muscle's pulling it. So that's where it's massive for us. A lot of runners get it. And the most common symptom for patellofemoral tracking disorder is going up and down stairs. Yeah, because the knee pain. Yep. So how we address that is foam rolling at home. You could do for sure. And then in the office, what we do, cupping and grasping to kind of release the IT band tightness.
Okay.
And then I give corrective exercises to help strengthen up the inside muscle on your knee, that vastus medialis.
And if you go to an orthopedist for that pain, what are they going to recommend?
They're going to say you got bone on bone, you need a knee replacement.
or at the very least, you need, not ACL, it's what?
Like a
PCL or MS, meniscus, MCL. You got to get that repaired. We got to cut you.
Yep. And I hate when you go to a surgeon, they say bone on bone.
I know.
You could do, you know as well as I do, the HA Plus, fantastic supplement for any kind of joint support. MSM, chondroitin glucosamine, just for the lubrication. There's a ton of things you could do instead of going under the knife and getting a knee surgery. Yeah,
they say that to scare people. I think because, I know that we've seen people come in and they said, my doc said I have bone on bone. What can I do? No, you don't, because you wouldn't be standing. You wouldn't have walked in here if it was bone on bone. That's just not possible.
And most of the time when you have a knee pain, it's usually coming from a different structure. So we treat stuff as a whole.
Yes.
So if you chronically sprained your ankle when you were a kid playing basketball and you don't have enough range of motion in your ankle, it dumps it on the knee. Same with hip. People with sustained hip injuries, it reflects on the knee. So I don't like chasing pain. So that's why we go through a very, very thorough exam in the room.
Yeah.
Just because, if someone says, hey, my hand's tingling, my hand hurts, why would you treat their hand if it's coming from their neck? You got to do a very, very thorough exam, pinpoint where the source is, treat the source.
Exactly. That is the mantra of holistic health in general.
Yes.
Get to the source, get to the cause, not the symptom. Don't treat the symptom. Most of the time, that's what's being done. It's interesting what you said about knees, because a lot of times with joints on limbs, it's another joint causing the discomfort or pain in a different joint, right?
Absolutely.
A lot.
Absolutely.
You start to favor a leg with an injury, and then that moves up, and then you have other issues, right?
Sometimes to switch sides. If you're really going with a limp, it'll switch to the other side. And then there's a ton of that. So that's one thing I like to do. It's fun to, when someone comes, they've been to a couple different providers, and they're like, Doc, I've been here. They come pessimistic. They're not going to give me better. Let me try it. And you actually get them some relief. That's one of my favorite things.
That is great. It's awesome to see your patients get well, isn't it?
Absolutely. It is. Yep. And we were talking with Phil and I think we were talking on Monday, the guy who came in, he couldn't sleep. His hands were killing him. He said they have severe arthritis. We lasered him in 2 visits, and remember him saying in 6 visits, he just wanted to be able to sign his name to check out. After 1 visit, he signed his name. That was unbelievable.
Those are great testimonials.
Those are great.
Yeah,
yes,
great
they were.
testimonials.
And so most of these too, you actually don't even have to have an injury. A lot of people come just for chronic tightness. You hear of the hunchback, the hyperkyphosis.
Yep.
You see that all the time. We help with that. That is giving corrective exercises that you could do at home, especially coupled with the therapy.
I want to just throw something in there. A lot of times when people get that hunch, and you can tell by looking at people who's not getting enough sleep, because that is a direct result of not enough sleep.
Yep.
Your body just doesn't have the ability to
Yeah.
to stay strong.
Perk up.
Yeah,
Absolutely.
perk up.
Stand erect. Yeah. All right. So the other ones we could talk about, muscle imbalances. So this kind of plays a case in certain pathologies as well. You hear of the upper cross and the lower cross syndrome. So upper traps get really tight, deep neck flexors turn off, and that's when you kind of get the anterior head carriage like that, right? So we do, both myself and Dr. Orbach do a lot of corrective exercises and trigger point therapy. And that helps a ton.
Let me ask you something. Do you,
Yeah.
when you're not in the office,
Yeah.
when you're just out,
Yeah.
do you look at people saying, you've got, yeah, I can see what's going on. I mean, do you do that all the time?
So I remember in school, a couple of our professors were like, you'll notice yourself, watching people when you're out and about. And it's true.
Yeah,
it's
true.
Definitely true. Yeah. Or you see some guy limping, you're like, oh, he's in bad shape. He needs to see someone. Yeah.
Okay.
That is very, very true. So, so basically, what we offer here that not a lot of other places offer is it's a full exam. So you go through a full exam. I mean, it's nothing skipped. We look in eyes, we look in ears, things that you think you would not go to a chiropractor for example, the tendonitis, ringing in the ears. Sometimes that could really be managed by chiropractic care.
Yeah. I used to see, Dr. Weiner used to go through and somebody would say, Doc, I've got this ring. He would grab their ear and yank it.
100%.
Right?
Yeah. So it could be three different things, but the two we treat, cranial nerve 8. That's the nerve that innervates your ear. If you have a nerve entrapment of that, or if you have inflammation around there, if you just treat that, they're going to be good to go.
Hey, let's talk. How about TMJ?
TMJ is massive as well. So, that's a tough one because that really hurts people, right?
Yeah.
And that affects their quality of life. And so, your temporal mandibular joint, it basically has a couple different functions, but there's one muscle in particular that is the bugaboo, so to speak. So it's called your lateral pterygoid muscle. It's actually inside your mouth above your top molars. It is to open and protrude your jaw. 9 times out of 10, that's the main player.
Right.
Yeah. So and some chiropractors you go to and they actually adjust your jaw. I'm not a fan of that because you have, it's called an articular disc that sits in there and it carries a lot of nociception, so a lot of pain fibers.
Oh, okay.
So if you just start wailing on their jaw, they're gonna be hurting. So
okay. So what do you do instead?
So me and Dr. Orbach, we do a lot of muscle release. So that lateral pterygoid muscle, 9 times out of 10, that's the main player. You could also work on the buccinator, temporalis muscle. And
where is that?
So buccinator is right here, temporalis is a little bit higher, and the TMJ is right here. So basically, it's like a modified pin and stretch. We basically assess how the jaw moves, and then based on which way that jaw is tracking, you treat depending on how it's tracking, you treat either the contralateral or that same side. People get relief.
See, that's actually why I'm sitting here with Doc, is because he has Doc speak that he uses a lot. He knows every single muscle in the body. He knows every single bone and joint, and he uses the technical terms that most of us say, oh, yeah, but we have no clue where that is. So we want to make sure everybody understands.
Yeah, so long story short, we work on the surrounding muscles, and the main one is that lateral pterygoid inside your mouth. If we treat that, 9 times out of 10, you're feeling a lot better.
Yeah. All right, great.
Yeah, so TMJ is another one that some people will think to see a chiropractor, some people won't. And just quality of life too. So,
and where do they go instead? The dentist.
Yeah.
Right, for TMJ, and it's not a it's not a dental issue most of the time, right?
Take a mouth guard. That's what they'll say. Wear a mouth guard at home, and that will do it. Yeah. and to speak to your point, I just like improving people's quality of life. So when you're saying, someone's hurting their low back from picking their grandchild off the floor, that is my goal. I'm very goal oriented and goal driven. So if you come in and your goal is to, you want to golf comfortably, or you want to be able to bake and move things without having the pain in your elbow, that's what I'm striving for. Very, very goal oriented care.
Excellent.
Absolutely.
Good.
Yeah.
Good. Well, any parting shots for us, Doc?
Even if you have an injury or any kind of pain that you think couldn't be assessed by a chiropractor, come give us a shot. I mean, it's way better than going to a surgeon, going under the knife, and then picking up the pieces after the fact, so to speak. Come in and get assessed. And I know when to swallow my pride, if it's something out of my wheelhouse, I'll tell you. And the good part about my job is know a ton of docs and surgeons that we can send you to if need be.
Right.
But most
Last resort.
Last resort, yeah. But try conservative care first.
Right.
Come in, get assessed, get treated. I guarantee you'll love it. You're gonna feel better, and just come in.
Yeah, come on in.
Just come in.
There's a wealth of knowledge here, Dr. Ross, and a great energy boost to the whole practice since you've been here.
Yeah.
And you always know when Doc's in town, right? As the energy is overflowing.
Yeah.
But we've been to him. I've been to him. Phil's been to him. We, Jamie goes anytime he sees him without a patient. He goes, "You got a minute? You got a minute?" He abuses it. You got a minute?
Yeah.
Yes, never a minute. But come on down. You're taking new patients, right?
Taking new patients.
Yeah.
Yep. So
if you have time, you have walk-ins, everything.
Call in, walk in. The front office will fit you in.
Okay, great.
Yeah.
All right,
Yep.
Doc. Thanks, sir.
Alrighty, thank
Pleasure.
you. Alrighty.
Folks, we'll be back in a little bit with Dr. Kathleen Geringer at 10. So come on back and join us. We'll be back in a minute.